Hi dear students. So our next topic is otosclerosis. It is also known as otospongiosis. Otosclerosis, more aptly called otospongiosis, is a primary disease of the bony labyrinth. You all know the anatomy of ear, right? So there is membranous labyrinth and bony labyrinth in the internal ear. So this is a disease that is affecting the primary disease of bony labyrinth. Also, it will affect the bones of the ear, that is the middle ear. There are three bones, right? That also will get affected in that, especially the stapes. Malleus incus stapes. Stapes is connected to the internal ear, right? That's why it is also getting affected. So otosclerosis is also known as otospongiosis. It is because the bone will convert into a sponge-like structure. That's why it is known as otospongiosis or otosclerosis. Most often, otosclerotic focus involves the stapes region, leading to stapes fixation and conductive deafness. So most often otosclerotic focus, before we told it will affect the bony labyrinth. Here they are telling that it involves the stapes region also, leading to stapes fixation. If it becomes spongiosis, if that bone is converted into a sponge-like structure, then it will cause the fixation of the stapes, and that will lead to conductive deafness. Etiology. The etiology is not known. The exact cause is not known. However, the following facts have been documented. So, anatomical basis. Bony labyrinth is made of encontral bone which is subject to little change in life. Encontral bone means the bone formed by from cartilage. So initially it will be a cartilage and it will convert into a bone in the later stages of life. So here the bony labyrinth is made up of encontral bone, that is normal, which is subject to little change in life. That there the cartilage has to convert into bone, but in some cases it won't convert it completely. But sometimes in this hard bone, there are areas of cartilage rust which, due to certain non-specific factors, are activated to form a new spongy bone. So here, the bony labyrinth is made up of encontral bone. That means the bone is formed from cartilage. First, it will form as a cartilage. After that, it will convert into a bone. But sometimes in this hard bone, sometimes it won't completely convert to a bony structure. So in between there will be cartilaginous portions which, due to certain unspecific factors, due to some factors, are activated to form a new spongy bone. That is otosclerosis. So its causes are not known, but anatomically we can explain like this. So this is a picture showing the stapes only. Stapes part it can convert into, first it is the foot plate. There it can convert into a spongy part, or the connection between incus and stapes, that also can convert into spongy part, that is otosclerosis. Hereditary. About 50% of autosclerotics have positive family history. Rest are sporadic. So 50% there is a chance of getting from the family history, from the ancestors. So hereditary is 50%. Hereditary is a factor. Race. White races are affected more than Negroes, and sex, females are affected twice as often as males. But in our country, autosclerosis seems to predominate in males. Normal rate in the whole world, if we'll take, females are affected twice, but in our country, it is affecting predominant in males. Age of onset. Deafness usually starts between 20 and 30 years of age and is rare before 10 and after 40. So the symptom is deafness. So when the patient complains of deafness and come to us, and when we do full checkup, then only we will get to know that it is autosclerosis. So that deafness will be evident at the time of the onset. It is starts at the age of 20 and 30 years, and it is rare in before 10 and after 40 years. And the effect of other factors, deafness due to autosclerosis may be initiated or made worse by pregnancy. So during pregnancy, the deafness due to autosclerosis can worsen. So during pregnancy, there is a chance of this deafness. And similarly, deafness may increase during menopause and also after an accident or major operation. So during menopause and also during an operation or major surgery, it can the deafness can become worse. So that is the effect of other factors. So these are the etiology. Etiology means this is like it's unknown, but some factors are anatomical factors. That is how it is forming. It is forming because it is an enchondral bone. This bony labyrinth is an enchondral bone. So enchondral bone, it means nothing but it first forms as a cartilage, and after in the next stages of life it will convert to a bony structure. But in some people, some part of the part won't convert to bone, so it will become remain as cartilage, and that will convert into spongy structure, that is otosclerosis. Then age of onset. Age of onset is that is deafness that is 30 to 40 between 30 to 40 years, only 20 to 30 years. After 40 years and before 10 years it won't be there. And also then familial history, that means hereditary. 50% there's a chance of getting because of hereditary. And also females are more affected, and in white races it is seen more. That is a etiology. And other factors are pregnancy, menopause, and all that will worsen the condition. Next comes the types of autosclerosis. So first one is stapedial autosclerosis. Here stapedial autosclerosis causing stapes fixation. As we discussed before, the stapes bone is getting fixed. There, the bony structure which is getting affected is stapes, and conductive deafness is the most common variety. So if it is stapes is getting fixed, means there will be conductive deafness. And here the lesion starts just in front of the oval window. You all know the stapes is fixed in the oval window, right? So just the lesion will start just before the oval window. And this is a site of predelection. So that is anterior focus. There are different types in stapedial autosclerosis only. So that is anterior focus, and lesion may start behind the oval window. Posterior focus around the margin of the stapes foot plate, that is circumferential in the foot plate, but annular ligament being free, that is biscuit type. So in this picture you can see it's a first in the front portion, that is anterior focus, and if it is behind, that is posterior focus. And if it is the margin, around the margin of stapes foot plate, means circumferential. And in the foot plate, but annular ligament becoming free, that is here, means it's a biscuit type. And if it is affecting completely complete destruction, then it is known as obliterative type. So these are the 5 types of stapedial autosclerosis. In stapes, how it is affecting. So first, autosclerosis can be stapedial autosclerosis, and other 2 more types are there. So in stapedial autosclerosis, again there are 5 types. That is anterior focus, posterior focus, and this is circumferential, and this is biscuit type, and this is complete, that is obliterate type. So these are these types of stapedial autosclerosis. Next comes cochlear autosclerosis. First is stapedial autosclerosis, and next comes the cochlear autosclerosis. Cochlear autosclerosis involves region of round window or other areas in the otic capsule. Otic capsule means bony labyrinth. Other name of bony labyrinth is otic capsule. So the cochlear autosclerosis involves the region of round window and also other areas of this bony labyrinth, and may cause sensory neural hearing loss. If stapes is affected, then it is conductive hearing loss, and if the bony labyrinth or otic capsule is affected, then it is sensory neural hearing loss. It is probably due to the liberation of toxic materials into the inner ear fluid. Next type is histological autosclerosis, that is in the level of histology. So this type of autosclerosis remains asymptomatic and causes neither conductive nor sensory neural hearing loss. So that is in the histological level only there is change in the bony structures. So that is histological autosclerosis. So these are the types of autosclerosis. First one is stapedial, second one is cochlear, and the third one is histological. In stapedial only there are again 5 types. In the anterior foot is involved, then it is anterior focus, behind means it is posterior, and if it is in the margin of the foot plate means it is circumferential, and if it is on the top then it is biscuit type, and if complete destruction is there then it is known as obliterative. And cochlear means the round window, oval window and round window, you know, right? So if the round window and all other these things, bony labyrinth, that is otic capsule is involved means it is known as cochlear autosclerosis. And the last one is next comes the pathology. Grossly autosclerotic lesions appears chalky white, grayish or yellow. So that where it is affecting, that spongy part will appear like chalky white, grayish or yellow in color, and sometimes it is red in color due to increased vascularity, and sometimes you can see a red color because of the increased vascularity, in which case the autosclerotic focus is active and rapidly progressive. So it is that focus will be, if it is red, the vascularity is more means then it will be active and rapidly progression will be rapid. So that is a pathology. So it looks like chalky white, yellowish or grayish, and if it looks red then the vascularity is more and it is active and progression will be more. So next comes the symptoms. Hearing loss. Hearing loss is the main symptom. This is present symptom and usually starts in 20s, and it is painless and progressive with insidious onset. So painless, only deafness will be there, and along with that there won't be any pain. So it is painless and progressive, and often it is bilateral conductive type. So both the ears will be affected. So hearing loss. So next comes the paracasus villisi. That means an autosclerotic patient hears better in noisy than in quiet surrounding. So that is known as paracasus villisi. That means he can hear more in a noisy surrounding than in a quiet surrounding. So this is because a normal person will raise his voice in a noisy surrounding, right? So in noisy surrounding we will speak more loudly. So like that, if that a person can hear clearly in noisy surrounding. Next comes tinnitus. Tinnitus, you know, it's a ringing noise inside ear and most commonly seen in cochlear autosclerosis and in active lesions. And next comes vertigo. It's an uncommon symptom that vertigo will be there. Then speech. Speech is patient has a monotonous, well modulated soft speech. So monotonous and that means well modulated soft speech. And tympanic membrane is quite a science in that tympanic, if we look through an otoscope, the tympanic membrane is normal and mobile because that end is not affected, right? Malleus is not affected, incus is also not affected, the stapes part is getting affected. So the tympanic membrane part looks normal. Sometimes a reddish hue may be seen on the promontory through the tympanic membrane, that is known as Chauvat's sign. This is the indication of active focus with increased vascularity. We mentioned before, right? So if active increased vascularity is there, then it will be red in color. So if we look through the tympanic membrane, you can see a reddish hue. That is because of the active focus with the increased vascularity. And eustachian tube function is normal. So it will be the test of a eustachian tube. If we do that will be normal. And tuning fork test shows Rinne test negative, that is bone conduction is greater than air conduction. Weber's test will be lateralized to the ear with greater conductive loss. So where the conductive loss is more, then there it will get lateralized. That is, Weber's test is lateralized to the conductive loss here, and absolute bone conduction may be normal. It is decreased in cochlear otosclerosis with sensory neural loss. So it may be normal, and it decreased in the cochlear otosclerosis also, where there is a sensory neural hearing. Next is pure tone audiometry. It shows loss of air conduction. So pure tone audiometry is a type of audiometry, and there will be loss of air conduction, and mixed hearing loss is also common in autosclerosis, and conductive deafness and also sensory neural will be there. Speech audiometry reveals normal discrimination score except in those with cochlear involvement. So in speech audiometry, that is another type of audiometry, there normal discrimination is possible. And tympanometry may be normal in early cases, but later shows a curve of ossicular stiffness. So it's like a graph. So it's normal will be normal curve can be seen in the earlier stage, but afterwards, if ossicular stiffness is there, then it will change. Then stapedial reflex becomes absent when stapes is fixed. Stapedial reflex means it's a reflex of stapedius muscle is there inside our ear. That is the involuntary muscle. So involuntary movement of the muscle. If we expose to loud noise, there will be contraction of that stapedius muscle. So that is the stapedial reflex. So that become absent when stapes will get fixed. So this is the tympanogram. So this is the normal curve, and initially it will be like this only, but later that this curve will change. So these are the signs of a autosclerosis. Next comes differential diagnosis, because here the deafness is the symptom, right? So otosclerosis should be differentiated from other cause of conductive deafness, particularly serous otitis media, adhesive otitis media, tympanosclerosis, etic fixation of the head of the malleus, ossicular discontinuity, or congenital stapes fixation. So from all these conditions, we have to differentiate otosclerosis. Treatment, medical treatment, there is no medical treatment that cures autosclerosis. So surgical treatment, we have to do stephanectomy with the replacement of prosthesis is the treatment of choice. So artificially we have to remove the stapes, and we have to artificially keep stapes like structure there. That is stephanectomy with the placement of prosthesis is the treatment of choice. Here the fixed otosclerotic stapes is removed and a prosthesis is inserted between the incus and oval window. So fixed otosclerotic stapes, the stapes which is affected is removed and a prosthesis is inserted between the incus and the oval window. Prosthesis employed may be a Teflon piston, stainless steel piston, platinum Teflon, or titanium Teflon piston. Any of this can be used. I'll show the picture in the next slide. Prosthesis, and in 90% of patients there is good improvement in hearing after stapedectomy. So after removing and replacing with this prosthesis, there is a 90% of patient is having improvement. So that is a surgical correction of otosclerosis. So these are the prosthesis, and this first one is a Teflon piston, and this is a platinum Teflon piston, and this is titanium. So these are different types of prosthesis we are using to replace stapes, affected stapes. And next comes the steps of stapedectomy: meatal incision and elevation of the tympanomeatal flap. An incision should be put, and that flap should be elevated. Exposure of stapes area. This may require removal of the posterior superior bone overhang to the canal, that is posterior superior part of the canal. And next comes removal of the stapes superstructure, and stapes is removed, and creation of a hole in the stapes foot plate, that is stepedotomy, or removal of a part of the foot plate, that is stapedectomy. So one foot plate is removed, a hole is made and put this processes, or the removal of a part of foot plate is removed. And placement of prosthesis. There we have to place the prosthesis and repositioning the tympanomeatal flap. So tympanomeatal flap, external auditory meatus, right? So that canal tympanic, they will put a flap, then stapes is exposed, stapes is removed, and keep this prosthesis and keep this tympanomeatal flap back. So that is stapedectomy. And hearing aid, so patients who refuse for surgery or are unfit for the surgery, then we can use a hearing aid at that time. It is an effective alternative. So there is no medical treatment, only surgical treatment, and if that is not possible, then we can use hearing aid. So this is about autosclerosis. So this is the autosclerosis or otospongiosis. Hope you all understood the autosclerosis and the treatment that can be given, and thank you.